Hello, my name is Dr. Michael Mack. I'm one of the residents here in the University of Calgary, here to explain to you Vitreoretinal Training B, Posterior Hyaloid Detachments, Navigation Training Level 4. In this particular level, your job is to use your dominant or non-dominant hand to enter the sphere using your sharp-tipped instrument. And the spheres are variable in size as well as their location. So some of them are actually quite close to the ora serrata. So like the other levels, you want to make sure that your tip goes into the sphere and that it doesn't slip out. That will cause you to lose points on the simulation. So what I like to do is I like to use the edge right beside the sphere um, and then just gently move into the sphere using a slow controlled method. So here I'm kind of next to it, and then I just make sure that I enter it, and then once it turns green, I hold it there. So I'm very steady, I enter, and then I know it turned green. So once you're able to get some of the posterior pole ones, it's now time to try the periphery. And so there are different little vessels and there are different little spheres that are located in the periphery as well. I like to use the 120 diopter option for the lens so that you can see further into the periphery. However, there is somewhat less magnification that you'll have to deal with. May be difficult for the smaller spheres. So moving to the side there, you're able to grid that. And then finally, one at the periphery. Oh, slipped out there. And so now what I'm going to do is I'm actually going to go to the console interface and then click on scleral depression. And you see here I've been able to see one sphere that I haven't been able to probe yet. And there's a second one as well. So scleral depression is actually pretty important for this particular level. So with this particular sphere here, what you want to be able to do is you want to be able to just scleral depress or pretend that there's an assistant to help you scleral depress, and then go on to the other side as well here. That way the sphere comes forward and it's a little easier to tell where it is relative to the retinal surface. So I'm just zooming out, and this is one more attempt at this level. So starting again, I'm now tackling the more peripheral ones first and then making my way towards the more posterior ones. There I found another sphere hiding in the periphery. Found one there. And then while I'm there, I'm going to attempt to enter into some of the spheres that are close by. It benefits a bit from having the depression to bring it more posterior. So now I'm attempting the ones that are more in the posterior pole. And I'm trying to be very careful just so that I can be next to the sphere and then enter it. It's very hard for these smaller sort of spheres, so you have to be very slow. And the final two. And there we go. So we scored 92 and 98, and the second one was a little cleaner. Thank you very much for watching. Please like and subscribe for more.